Hi, my name is Liana Laughlin, your Muchaning Minalin 2019. As you can see, I am back from the previous procedures we have done in the clinic for slimming down my face. But since the effects are not permanent, I have to be back for retouch after 4 to 5 months to keep the beautiful and lasting effect. Today, we will be doing a retouch for my jawline BOTOX and also my nose to keep my face smaller. And don't forget to click the subscribe button and the notification bell to keep you posted.
Good day everyone, welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we have a follow-up treatment from one of our beautiful guests. She was a beauty queen. Okay. And let's all welcome Miss Liana.
Hi everyone.
So Liana is back. And she had doctora previous treatments?
Yes, she had this on August 2019. She had this Ultherapy in her face and also the Jawtox.
Yeah, so the injection of toxin on the masseter to achieve a smaller face. And let's now look at Liana right now. Hi Liana.
Hi.
So yeah, look at her. I was shocked, like after a couple of months, her face became smaller, narrower, slimmer. So what do you want to share to our televiewers regarding that becoming smaller or having that slimmer face?
Well, it has definitely made me more confident in front of the camera, especially, and looking back at my photos months ago, I can't believe that's me.
Yeah,
I'm very happy with the results also.
Up to now, I'm really like, wow, I'm like shocked, like, because I know Liana, I saw her face before, so the width of her jaw, it was really wide, and really, because she's still young, okay, you could say she still has a baby face or like a chubby face, being young, okay, for me, you're still a baby, okay, so right now, you can see her, and I think most of your friends, the people around you are asking what you did.
What I'm doing,
So they can like fathom in their mind, what did you do? How did you make your face that small? Right?
Yeah,
so
actually get that a lot.
they were surprised, they were like in awe. Yeah. So right now we have Liana, because it was already how many months ago?
Since October, Doc, we have also the Alartox.
Okay. So the August was the Botox of the
masseter.
masseter. So it's already 6 months?
Around 6 months.
Yeah, and then this one around four months, something like that. So right now, what we're going to do for Liana is like a maintenance treatment to really keep her face smaller and narrower, and also make this masseter muscle as well as the alar tissues really make it smaller, maintain it into that smaller shape, right? And actually, I did an assessment a while ago on the masseter. There's already this, like the strength of the muscle is coming back. You can feel it, like if she contracts it, there's already a bulging effect there. So, of course, we have to do something to prevent it from becoming bigger again, hypertrophied again. And the same thing with the alar region, because I really noticed also still, up to now, it's still narrow, right? Although it was 4 months already. So we can add alar treatment again, injection of that toxin again to further narrow it. Okay, so
to note the measurement, Doc, pre-BOTOX, when October, it was 35 millimeters. And now I measured it 30. 30 na lang siya.
Yeah.
So I guess
so that's
meron pa siyang
the
toxin.
width of the alar regions.
Yes.
So it was 35 millimeters
Before.
to 30 millimeters. So there was like a 5 millimeter difference already. So we could really say that the injection of toxin for the alar region is an effective way of narrowing the alars. But of course, for some people who really have a very, very wide alars, or like the cartilage is really that wide, because the toxin is targeting only soft tissues. Now, for those with really very wide alars, I recommend doing surgical reduction. So you can do alarplasty or alar trimming, because that one is already with the cartilage. But we have seen some people, it's just the tissues that are really bulky or bigger. So you can work with that using your botulinum toxin. Okay, so I think we can proceed with the treatment for Liana. So we're now going to inject our botulinum toxin on the masseter region here at the right side. So I have here my syringe containing this toxin here. We call this treatment, Doctora, Jawtox. Yan. It's the angle of the jaw and then the toxin that we're gonna be injecting. So I'll just palpate the masseter muscle. So I'll ask Liana to bite. Ayan. So I felt the contraction of the masseter. So just a single injection here. Okay, into the muscle layer. So intramuscular injection. And I'm gonna be pushing about 10 to 15 units. Since this is a follow-up treatment, so we'll be just using lesser dose na lang for Liana. Okay, so I'll be giving na a 15 unit dose. Okay, so that's it. Basically a single injection only. Then let's do the left side. Same thing on the left side, the left masseter region. Liana, bite again for me. So I'll inject into the strongest point of contraction intramuscularly. So another 15 unit here. Okay. How are you feeling, Liana?
Okay.
Good. So 15 unit here again. And that's it. Okay. So just a single injection on each side of my toxin to make the masseter smaller. So our goal was to make Liana's face really smaller. We made use of ulthera, we made use of toxin for the masseter, and I could say Liana's face really so small, like it could fit the palm of her hand, right? So, kasing laki na ng kanyang kamay ang mukha, right? Parang yan ang goal ngayon eh. Parang ang size ng mukha mo, size na lang ng palm mo or ng kamay mo, okay? Ako yata, hindi. Okay. So, right now, we'll also be doing the injection of the toxin on the alar region. So, well, Liana, it was really effective, right?
Yeah,
so,
very.
4 months ago, you have noticed the narrowing of the sides of the nose. And looking at the nostril region, there's this curvature naman on the alar region. Okay. If you look at the cartilages, actually they're near each other. For some people, kasi it's really very wide and the alars are really widely separated. But for those, I really recommend some surgical reduction or yes, exactly. But for Liana, we just wanted her to have these soft tissues of the alar become smaller. Kasi it's like bulging, it's like a thicker tissue. So we wanted it to become thinner. Yeah. So with the use of the alar toxin injection. Okay. So we'll do this. Okay. So actually we can inject 5 unit for each side. Okay, there will just be some discomfort, Liana. I'll touch the alar. Okay, it's just a pricking of an acne. Inhale, exhale. There you go. And then entry. So some pressure there, forgive me. And that's it. There you go. Some sensation on the alar injection. So let me do the other side. So on the other side, okay, so let's do the right alar. Inhale, exhale. And then push the botulinum toxin into the alar tissues. Okay, there you go. So I did 5 unit on each side, and on the masseters 15 units on each side. Okay, so we have done injection of toxin on the masseters as well as on the alar regions, and we have also included a little bit on the tip region, the rounded tip. We wanted to make it less rounded and somehow make it narrower. And also I added a little bit about 2 units on the depressor nasi muscle that's under the columella, so that the muscle will not be pulling the tip downwards, to maintain it somehow upward. Yeah, that's one technique also. The others are injecting on the levator superioris muscle for those with a gummy smile. Yeah, I remember somebody was asking me, what about gummy smile? Where do you inject toxin? So the levator superioris muscle, or you can also inject near the alar groove or the base of the alars. Okay, so tip, isang tip. Okay, so Liana, how are you so far?
Well, I'm okay. There was like a tiny bit of discomfort for a few seconds, but after that, it was like total relief.
Right. Yeah, it's normal that you feel the injection and the nose, the sides area. That's expected because we have a lot of sensors, nerves in that area. Okay, but so far we'll see the result. Usually we say 1 to 2 weeks for the Botox to take effect. Ayan. And do you have any questions, Liana?
Well, I just want to know like how long this lasts and how often I should do it.
Yeah.
Like
how regular?
Yeah, how regular.
Often?
Yeah, how
so
often,
we've done your masseter injection 6 months ago. Okay,
Mm-hmm.
so you can repeat after 6 months. The earliest will be 3 months to repeat when I do it in my clinic for my patients. And then with the alars, we did that 4 months ago, right? So in terms of managing or doing toxin injections, like in a year, usually we say twice a year. But time will come. They said that there was a study like on the 6th time you've done it, and then after that, the duration becomes longer. So time will come that you can do it once a year, like that. So maybe the masseter will no longer enlarge or will not be hypertrophied anymore, as well as the tissues here, they may not like expand anymore. Okay, so case-to-case basis, some people would need it more, especially those with very thick muscles and very kinetic, hyperkinetic or hyperactive muscles. So it's a case-to-case basis. And then of course, Liana is still young. She's just, how young are you again?
I'm 17.
Still a teenager and joining a pageant, Miss Teen something?
Yeah. I'm planning to join Miss Teen Philippines, so I'm doing all this to prepare. Thanks to Doctora, making me look more beautiful all the time.
Yeah, so we're hoping for your success in that pageant.
Thank you so
Okay,
much.
you win also, and we're honored to be a part of that journey. So we have seen how effective the treatment was for Liana using ulthera as well as the injection of toxins, because everything that we do here, of course, we are making sure that they will be very effective, that there will be results. So we should be very result driven, right, Liana?
Yes.
Now, there was a question, can we also do this for men?
Yes,
Is this kind of like face slimming, the Ultherapy, even the injection of masseter or with toxin and the alars with toxin, can we do it for men? Okay, so I think let's discuss that, okay, in a little while. And thank you, Liana.
Thank you so much.
And we'll do the next treatment. So answering the question about is Ultherapy also for men? And is the injection of the masseter or even the alers also for men? So, Doktora,
Yes.
ano po ang ating sagot? So, we have right now a returning guest also. Let's welcome Arvin Santos. Yan.
Hi, Doc.
Hi, Arvin. Welcome back. So, he was with us about how many years ago? 3 years ago, and we did chin enhancement for Arvin. And I think Arvin became busy with his career. Yan.
Work.
Yan. Work. Okay, career-oriented person. So we have Arvin here to do a treatment, non-surgical, non-invasive. And basically, his concern is his shape of the face.
Yes.
Okay, ang feeling ni Arvin, malaki yung dito sa part na to. Okay? And of course, he wanted to do a contouring na babagay sa mukha niya, yung shape na tama lang for his age, young age, 20s.
3.
O yan, bagay sa age niya. And of course, sama meron ding jawline definition. And another concern ni Arvin, yung masseter niya, ayan. Sige, bite Arvin. And very strong, very strong. So we can also do injection of masseter for Arvin. Kasi actually, it's too strong. It's super, I could say, hyperkinetic. Okay? Very dynamic and hypertrophied masseter muscle. So we wanted also to slim the muscle, make it relax, okay? With the help, of course, of our botulinum toxin again, okay? So we'll start with our ulthera. So good thing we have the ulthera, and it's been very effective in slimming the face, contouring the face, also for lifting, tightening, firming skin. Daming benefits nito eh. Okay?
Skin laxity also.
Exactly.
Non-invasive lifting po yan.
Alright, so ito ang application nito, full face, neck area, and décolleté. So, for those who are also concerned, not only sa face and neck, yung iba yung upper chest nila, so meron na mga wrinkly skin, tapos saggy or yung nga aging skin, yan. You can also do our Ultherapy for that part, okay? So, in terms of the full face, so upper third, middle third, lower third, you can do our Ulthera, and then also in the neck region, except lang yung doon sa may thyroid tissues lang, okay? What we're gonna do with Arvin, kasi concern niya yung dito niya, medyo, sabi niya, malaman daw. Malaman ba?
And also we could describe also the skin laxity no on young
Exactly. Actually, ayan, aging starts at 20s. Kasi na, overwork. Diba yung stress daw? Internet daw, puyat, over-fatigue. It really accelerates aging process. So, medyo nakikita ko kay Arvin, ang sipag na bata, some signs of aging na. Ayan, yung mid-face section niya parang medyo nag-start ng magsag. So, we wanted to restore yung kanyang magandang mid-face, of course. We wanted to restore itong curve na to. Dapat hindi yan magsag. Okay? I can use my Ultherapy 4.5mm to target yung mga deeper tissues na gustong i-target ni Arvin. Okay? I could work on this side. Dr. Nino will work on the other side. So, this is just an easy procedure. I just grasp the tissue here and do my first shot here. Okay. How did that feel? Okay lang?
No, wala.
Okay lang. Because a while ago, we left topical cream about an hour, no? Para talagang mag-numb yung skin. So, we'll just do a treatment to lift the mid-face section so it will not sag. And actually, yeah, meron pa rin yung parang mga fatty tissues kasi bata pa si Arvin. So, meron pa siya nitong mga sinasabi naming baby fats. Tama, Arvin?
Yes po.
Ayan. So,
Chubby cheeks.
ayan. Okay, we did chin enhancement on Arvin 3 years ago. Pero so far, so good. I can see yung chin niya. Okay pa rin. Tamang-tama pa rin sa face niya. And ngayon, usong-uso yung nagpapaliit ang mukha. No, Arvin?
Korean drama.
I think that's a trending right now. And even for men, we have a lot of men. Now, they come to the clinic for Ultherapy also. Kasama na yung, of course, yung ating mga seniors natin, they wanted to do skin tightening, firming, lifting. They wanted to target yung mga lax tissues nga. And, of course, they wanna restore yung youthful look, rejuvenated look. And the good thing with the Ulthera, it also induces collagen stimulation. So, you have an effect of the collagen giving this or restoring that tight structure inside. So, the collagen synthesis is very important. Plus, I noticed also among those who had Ulthera, yung skin nila, nami-minimize yung pores. And Yeah, that's an effect also of the collagen formation. So parang may pore reduction also. And if you're gonna look at their skin, nag-improve yung texture.
Maybe that's the property of the tightening of the skin also.
Exactly. That's why meron siyang skin rejuvenation effect talaga.
It's an anti-aging process also.
Right. Now, the ulthera is totally different from the other devices na mga tinatawag nilang mga HIFU. This one is MFUV. So, microfocus ultrasonic or microfocus ultrasound with visualization. So, this is more precise actually because in that screen there, you can see yung mga anatomical layers that you wanted to target. So, safety, precision is there.
Yes.
You're in the right anatomical depth.
You're not having treatment with blind spot. So, nakikita
Exactly.
natin sa Ultherapy kasi visualization.
Of course. So, very unique ito. Kakaiba yung technology niya. Actually, trying to imitate it, but nobody was able to, well, actually, merong imitation, but not really a perfect Ulthera. Okay? That's why we always share with our televiewers, make sure your Ultherapy provider has the authentic Ulthera machine.
You can go to MERS Philippines, dun sa website nila. So, dun sa mga service providers.
Exactly, right.
Yan silang location.
Because we see a lot of like advertisements on social media right now that they put Ulthera there, but it's not really Ulthera. So you better ask also the Ultherapy provider, ang MERS Philippines, if that center really has the authentic and if they have their seal or certification of authenticity. Kasi
Ultherapy provider.
they're shocked kasi bakit sobrang mura daw yung Ulthera ng iba compared with the other centers. So that's the reason why po, kaya mura po, it's not original. Okay? It's not authentic. Exactly. And of course, we have providers for this or mga, like for example, we have our employees here who are doing Ultherapy. They were trained.
Yes.
They were given certification of training. So in our center, like if I do it, Dr. Ninya Ong will do it, and our assistant will do it because we had the proper training for doing our Ultherapy treatment. So if you notice, more of my focus is yung dito sa may midsection also. I wanted to contour this part here and I wanted to do a lifting here. Okay, so I can hear the sound already. So Dr. Ninya Ong will proceed to the other side. After our therapy, let's proceed to the injection of our masseter with our toxin here. So bite, Arvin. Okay. So I'll be using like a 20 unit for this side. Injecting lang. And then another injection. Bite. So I'm actually placing the toxin in the area where there's much of the contraction. Okay. So I'll go to the left. So we're proceeding to the left masseter region. Bite please. Okay. And pushing this product here. So we're using botulinum toxin to relax the masseter. Okay. So this is an effective treatment for masseter hypertrophy. Okay. So done. We're good. We're okay. So we have done Ultherapy and the injection of masseter for our vein. Okay. So far so good. Okay, actually we'll wait for the results. The masseter usually it takes effect in a week or two, and then for the Ultherapy we wait like 30 days, 60 days, 90 days for the maximum effect.
It's a
Okay,
gradual
so
improvement, Doc, for
right.
facelifting.
Yeah. So far so good, and Arvin is feeling comfortable, right?
Yes.
So
No
in terms,
pain.
exactly. So the Ultherapy naman is tolerable, or there's a sensation na parang tiny pricks, and merong heat sensation also because it has some certain temperature.
Yeah, 60 to 70 degrees Celsius.
Yeah, for the thermal coagulation, which is important for our Ultherapy. Ayan, so nasagot ang ating mga katanungan na pwede ba ito sa kalalakihan, maging ng injection ng masseter Botox as well as the Alar Botox. Na with the Alars ni Arvin, di naman niya po kailangan. So, what we just did is for the masseter plus the Ultherapy lang. And we'll also recommend some skincare treatment for Arvin. Of course, in our center, we have to also, of course, improve the texture of the skin. Yes. Kasi nga, overwork.
Yes, thank you, Doc.
So, kailangan din ng skincare treatment and part of our health as well. Okay, thank you, Dr. Arlinia.
Thank you.
Thank you, Arvin. And of course, sa inyong lahat, maraming salamat po. Kung meron silang katanungan, you may email us at csaskinclinic@yahoo.com or at our FB page, you may send a message. The FB page, CSA Derm Centre, or our Instagram, CSA Derm Centre. And we have our other videos at our YouTube channel. Just type Contessa Salvador. And please do not forget to click like and subscribe as well. Okay? Thank you. God bless you all. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.